Hello everyone, my name is Lee Junqi, and today I will be presenting my research proposal titled The Effects of Drone Burnout on Nurse Job Performance in Malaysian Public Hospital. This study focuses on understanding how different dimensions of job burnouts influence nurse work performance and the quality of healthcare service in Malaysia. Okay, firstly, let me introduce the background of this study. Nurse plays a vital role in Malaysia's healthcare system because they provide direct patient care and support the daily operations of hospital. However, due to increasing workloads, long working hours, shift duties, and emotions demands, many nurses experience job burnout. According to Macaras and College, burnout consists of three dimensions. First one is the emotional exhaustions, depersonalizations, and reduced personal accomplishment. Burnout not only affects nurse physical and mental well-being, but also reduce the quality of patient care. Therefore, it is important to understand how burnout influences nurse job performance so that effective strategies can be developed to improve healthcare service. The problem addressed in this study is that job burnout has become an increasingly serious issue among nurses working in Malaysian public hospital. Although previous studies have examined burnout among healthcare workers, there is limited research focusing on how the three dimensions of burnout collective influence nurse job performance in Malaysia public hospital. Therefore, this study aims to fill that research gap. The main objective of this study is to investigate the effects of burnout on nurse job performance. More specifically, this study examines the influence of three burnout dimensions: emotional exhaustions, depersonalizations, and the personal accomplishment. To advise this objective, four research questions are proposed. The first question asks whether emotional exhaustion has a significant relations with job performance. The second examines whether the depersonalizations affect job performance. Finally, the third investigates how personal accomplishment influence performance. Finally, the fourth question explores which burnout dimensions are the strongest predictors of nurse job performance. Next is in the literature reviews. Okay. Previous study has consistently shown that burnout negatively affects nurse performance, especially in stressful healthcare environments. The first dimension, emotional exhaustion, is the most common forms of burnout. Nurses who experience emotional exhaustion often feel physically and mentally tired, which reduces their work efficiency. The second dimension is depersonalization. Nurses with high depersonalization may become emotional detectives from patients, resulting in poor communications and lower patient satisfaction. On the other hand, personal accomplishments has a positive effect. Nurses who feel completed and successful in their work tend to be more motivated, perform better, and cope more effectively with workplace stress. Overall, previous research suggests that reducing burnout can improve both nurse performance and healthcare quality. This slide presents the conceptual framework of the study. The three dimensions of burnout, emotional exhaustion, depersonalization, and personal accomplishments are the independent variables. Job performance is the dependent variables. The framework proposes that emotional exhaustion and depersonalizations are expected to negatively affect job performance, while personal accomplishments is expected to have a positive influence. These frameworks serve as the basis for testing the research hypothesis. Now, let's move on the methodology. This study adopts a quantitative cross-sectional research design because it allowed the researchers to measure the relationship between variables using statistical analysis. The participants are full-time registered nurses working in Malaysia public hospital with at least 1 year of clinical experience. A multi-stage stratified random sampling method will be used to select participants from different regions of Malaysia. Although the minimum required sample size is 77 nurses, this study plans to recruit approximately 400 participations to improve the reliability and generalizability of the findings. For data collection, a structured questionnaires will be used. Job burnout were measured using the Macalus Burnout Inventory or MBIHSS. We conduct 22 items measuring emotional exhaustion, depersonalizations, and personal accomplishments. Job performance will be measured using the Individual Work Performance Questionnaire, also known as the IWPQ. After data collect, the response will be analyzed using IBM SPSS software. The analysis includes descriptive statistics to summarize the data, person collections to examine relationship between variables and multiply linear regressions to identify which burnout dimension best practice job performance. Based on the previous study, this research expect emotional exhaustion and depersonalizations to have negative effects on nurse job performance. In contrast, personal accomplishments is expected to have a positive influence. The findings of this study will be valuable for hospital administrators because they can be used to develop strategies that reduce burnout, improve nurse well-being, and enhance patient care. In addition, this research may provide useful information for future studies and healthcare policy development in Malaysia. So to conclude, job burnout is a significant issue amongst nurses working in Malaysia public hospital. This study aims to examine how emotional exhaustion, depersonalizations, and personal accomplishments affect nurse job performance. It is hoped that the finding will be contribute to improving nurse well-being, strengthening healthcare qualities, and supporting better management practice in Malaysian hospitals. Thank you so much for your attention. This is end of my presentations, and I will welcome any questions you may have. So bye bye.